everyone. I look forward to spending some time talking with you today more about assessment centers, and then certainly spending some time hearing from you all in terms of where you are in the process. My name is Carly Cater, and as Molly said, I'm the Director of Operations at the National Assessment Center Association. Prior to being with the NAC, I was the director of the National Center for Youth Opportunity and Justice. So I've really worked with communities and in the space of supporting communities develop diversion opportunities for youth who are coming into contact with law enforcement, with the courts, with probation, so with the justice system at this point for about 20 years. So thinking about from a policy perspective, through training, through kind of research and evaluation, what are opportunities that communities can leverage to really support youth and families in the community. And with that, I'll turn it back to Molly.
Thanks, Carly. All right, I'm going to just give some time here this morning. I'm going to change slides because I think this next one is a must-have in these presentations, that some of you might have seen this before in terms of a disclosure there. So I'm gonna start on this slide, but before I jump into it, I think we're in a function where you can enter into the chat. It'd be really great for Carly and I both to hear from you all. One, on what jurisdiction you're coming to us from, and then also maybe just a sentence or two on where you are in the process of exploring the assessment center framework. So if this is your first time hearing about it, great to know if you're kind of in this learning exploration phase, or if your community is actually moving in the direction of establishing an assessment center, and what might you have already done locally in that process. So if you can just use the chat function and give it just a minute or two for folks to type. Great, DC, Indiana. Texas, great. All right, well, we'll learn a little bit more about each one of you as we go into those breakout sessions. See, Ohio, West Virginia, awesome. Today is really, kind of an assessment center 101. What is an assessment center? What does the National Assessment Center framework kind of establish as the core components of an assessment center? And what are some examples of how assessment centers operate around the country? And then we'll go into a little bit more about what the National Assessment Center Association does and how we support jurisdictions. So I'm going to go over some foundational knowledge here, and then I'll dive into what the framework is and what assessment centers are. The important thing here, the slide here up on the screen, why assessment centers matter. These are all ways that assessment centers, or I would say reasons that communities establish assessment centers in the first place, and what assessment centers aim to achieve. Right, so preventing unnecessary involvement in both the juvenile justice and the child welfare systems, and we'll talk more about those referral pathways. Intervening early on to connect youth and families to community-based services and supports. That really the assessment center's role is to identify some of those unmet needs, mental health needs, substance use needs, basic needs, pro-social needs, and getting youth and families connected to community and community-based support. So you'll hear me say this probably a couple times today, but also you'll see in a lot of our publications at the association that assessment centers are the connectors. They are not the providers of services, which I think is important for us all as we walk through this. They are intended to be community-based hubs that are building trust with both the provider community, with families, and with systems. And all of those kind of different buckets, the community, youth and families, and systems are using the assessment center as that hub in order to get young people and their families connected to services and supports that are individualized to that youth and family. We really try to make sure that assessment centers are it's not a one size fits all. This is the program that every youth and family go to, or this is the service that every youth and family that are diverted from a system need, that it's really based on that individual youth and families, ultimately working to improve outcomes for youth, families, and communities. So assessment centers, it's not necessarily a new concept. This is a snapshot from the OJJDP fact sheet back in 1999. At the time, they were referenced as community assessment centers. And you'll see kind of an excerpt over on the right-hand side. Communities across America are looking for more effective and efficient ways to help and identify juveniles who are at risk of becoming serious, violent, and chronic offenders. And this is really assessment centers. There were 2 in Florida and 2 in Colorado that were piloted in the 90s, and it really evolved from there. You'll see some of the bullets here in terms of what was happening in communities at the time that led to the genesis of assessment centers. Several of these, or many of these, I would say, are still in existence today in terms of the reasons why communities are seeking out assessment centers as part of a community-wide solution to establish that connection to care and to help support the continuum of care for youth and families. So at the time in the 90s, an increase in youth crime, youth and families needing the requirement, and I know a lot of communities feel this still to this day, but we have to get systems involved in order to get youth and families access to services, and really trying to break down that barrier, increasing coordination and collaboration, trying to make sure that the time frame from when young people are identified, specifically in the 90s at the time of arrest, to when they were actually getting connected to services, which was much quicker and shorter, making sure that we're using detention appropriately, and just needing more preventative services for at-risk youth. So all of these were the reason why assessment centers began. And they really have evolved, I would say, over the last 30 plus years. We now have over 120 assessment centers across the country. And I'll talk about a couple of them here in a minute. One important thing that we always like to show this slide, because one thing in that evolution of assessment centers over the last 30 years, while they were initially, especially in the OJJDP briefs and some of those initial documentation called assessment centers, that some communities choose to use that terminology and some choose to use different terminology. So we have some that are called many, especially if you're looking at the state of Ohio, are called resource centers. We have others that are called kind of prevention or connection centers. And then to make things even more muddier, some that are called none of the things that are on your screen, and really, I would say, locally named. So you have the Front Porch in Savannah, Georgia. You have the Harbor in Las Vegas. So all of a lot of different names. You have the Bridge in Boise, Idaho. So they may be locally named. What we really look for at the National Assessment Center Association is that they're following best practice in the framework of assessment centers, which is what I'll go into a little bit more detail on. So assessment centers are really designed to serve as that hub in a community to prevent and divert young people from system involvement. Again, both child welfare and the justice system. That hub and that function of the hub is what we call in the framework is a single point of contact. So it essentially is speaking to the referral pathways in, which I'll go into a little bit more detail on here in a second. But once that referral is made, the assessment center's role is to identify what are some of those underlying needs and strengths of the youth and family, and to help and partner with them to access individualized services and supports that are going to meet those needs and leverage those strengths. So that again is when we get to the connector piece. You see that third icon. The assessment center's role is really that connection, matching services and supports in the community to the needs and strengths of the youth and families. So this, you'll see the three core components of the assessment center framework. The three process core components, I should say, there's actually five. Two of them speak to how assessment centers are structured and how they operate. Three of them actually speak to the process that assessment centers implement. So single point of contact is essentially the referrals in, or the pathways into an assessment center. How do young people get referred? And the big thing I would say here is, how does policy change support those referrals? So, and you'll see in the examples as I give you, we'll see, I would say in a preventative way, youth and families kind of self-identifying. But really where we see assessment centers in communities thrive is when there are system stakeholders that implement policy change to use assessment center in lieu of, I would say, more punitive action, right? So for schools, in lieu of suspension, expulsion, in lieu of court filings for truancy or chronic absenteeism. For police, we see assessment center used in lieu of, maybe filing a petition or an allegation to the court. And then at the court level, filing that petition or moving that petition along in the court process. So all of those kind of various concerning behaviors within that, right, are reasons for referral, but the referral sources are typically, in terms of the system stakeholders, law enforcement, schools, child welfare, or your court systems. Once that referral is made, the screening and assessment process within an assessment center is really meant to, again, identify those needs, identify strengths, and then get those young people and families connected to individualized care, which is that case management, that third core component. So a little bit more about the referral pathways in. These are, we put these into three different, I would say, buckets within the Assessment Center Outcome Reporting Network. This prevention, so before law enforcement involvement, this is typically where your youth and family self-referrals will come in, community referrals, your faith-based community, really using the assessment center when maybe there's a behavior that's concerning, or a youth and family is struggling, as a way in order to get connected to community-based services and supports. I mentioned the school referral. Really where we see assessment centers implement or partner with system players to implement policy change is around that chronic absenteeism, or some of your, I would say, behavior infraction or response to behavior infractions, right? So if there's maybe a fight within the school, if there's drug and alcohol on the premise, that we're using the assessment center to really dive into what are some of the underlying needs and getting those youth and families connected to supports, maybe in lieu of, or maybe in conjunction with some of the typical school responses, right? The other one there is diversion. So we're seeing assessment centers being used by law enforcement as a pre-arrest diversion pathway. So you'll see law enforcement kind of where they would typically file an allegation within the court. They will then off-ramp that allegation to the assessment center. And then we see the pre-file or pre-adjudication, so that early intervention at the court level. The other piece here, which I mentioned earlier, is child welfare. This is really, I would say, when you look at the history of assessment centers over the last 30 plus years, they really started with this focus and this aim on the juvenile justice system. And we all know the crossover and the connectedness of kids that are in child welfare with the justice system and vice versa. And many of the assessment centers that you see today are really now kind of I wouldn't say switching focus, but adding in this pathway of child welfare. So, when maybe a call is made to the hotline and it doesn't reach the level of abuse and neglect, but there's still some supports that youth and family could use, the child welfare systems are using the assessment center to help make those connections. Another big one here that's not listed, but I think could fit in both child welfare and kind of this prevention is hospitals, right? When we see young people that maybe they're not meeting the threshold of admittance into a hospital for behavioral health, but obviously services and supports could still be beneficial. Oftentimes, each one of these systems, um, there's a reliance on them without an assessment center to know what the right service and support is when that's not really their expertise. They don't know the landscape of the service provider community. And more importantly, maybe there's not a screening and assessment done that is used to better understand what those needs actually are before we're making that referral to the community. And so each one of these kind of decision points is able to use an assessment center to take a step back. Let's better understand what's actually going on at home so that when we make that connection, it's the right connection at the earliest possible time. So this is a couple examples here to kind of put each one of these pathways into actual practice. This is the Juvenile Assessment Center. It's the 18th Judicial District that actually they just split, so they're actually serving the 18th and the 23rd. This is the assessment center that I used to be a part of in Colorado. They serve in almost every single one of those off ramps or those pathways that were described. They are the hub in the community for just about every single one of them. So all young people in Colorado, the youngest that you can be arrested is 10 and the oldest is 17. So any young person, even if they're eligible for detention, if they're not eligible because of the detention screening tool or the level of charge, or if they're being seen by law enforcement, but not receiving charges. So if they're a runaway, if it's what we used to call beyond the control of parent, all of those young people could be brought to the assessment center or referred to the assessment center as for an opportunity at diversion and early intervention. They also have a very strong what they call the community assessment side, where it's all community referrals before law enforcement come into play. So schools, the Department of Human Services, which leads to the child welfare referrals, Medicaid, Colorado Crisis Line, parent self-referral, hospitals, churches, all of those could use the assessment center as that hub in order to get youth and families connected to services. The other one, this is a screenshot of the Shelby County. They call it the Youth and Family Resource Center. So the name there, going back to one of those earlier slides. This assessment center is about 2 years old, so fairly new, and in Memphis, Tennessee, if you don't know Shelby County, Memphis. And they really started out using the assessment center as a pre-arrest diversion hub in the community. So at the time, you'll see this screenshot, there's 12 offenses. I believe now they've increased that to 14. They also piloted their assessment center with one specific police jurisdiction within Shelby County, and they've expanded this now through the entire Memphis PD. So there are 14 offenses that would have traditionally been filed as an allegation in the court that are now sent to the assessment center as a pre-arrest diversion hub in order to do that screening assessment and connection to care. And then the last example that we have here up on the screen for you is to show, I should have said Memphis, in addition to law enforcement and the pre-arrest, they also are very much have different community locations where youth and families can self-refer, and they also work with the school district. So both the Colorado Assessment Center and Memphis are really serving in multiple different, I would say, pathways in terms of referrals in. This assessment center in Douglas County, Nebraska, is a very specific referral pathway, which I think is important for you all to see kind of how different assessment centers can function. So this is an assessment center that is strictly, I would say, post-arrest and pre-petition. So the county attorney's office uses the assessment center and diverts every single case to the assessment center unless it meets one of the three kind of bulleted criteria that you see here. So unless it's already in some sort of adjudicatory or formal court process, unless that young person is being detained, or unless it is a delinquent act that involves a sexual assault, every other case gets sent to the assessment center for screening, assessment, and connection to care, and as a diversionary mechanism from formal court processing. So they just celebrated their 20th year anniversary and have served almost 30,000 kids at this point. This 28,000 was last year. So, that I wanted to highlight those as examples because we get a lot of questions from communities on, at what decision point do centers sit? And, our answer is always it varies. And it's important because assessment centers really need to be adapted to the local community. And every community looks different in terms of how their stakeholders interact, how their system processes are. And where the assessment center is going to fit best for that community is going to vary from one to the next. So it should never be a cut and paste. And usually where we see the most variance or kind of the most adaptation is there at the referral pathway into the assessment center. Once that referral is made, this is really the assessment center process up on your screen. There are a variety of different screening and assessment tools that can be used. We really speak to the screening and assessment process because it shouldn't just be based on tools. Tools are helpful and should definitely be a part of that process, but it's really it's just that it's a system, and it's all about how you set up the screening and assessment process, how those tools are administered, how they're interpreted, how they're fed back to the youth and families. So we're looking at a whole kind of a whole list of different domains: basic needs, mental health, substance use, trauma exposure, suicidal ideations, exploitation, physical safety within that screening and assessment system. Most assessment center staff are trained in motivational interviewing in order to build trust and rapport with family, and really working alongside the family to build out a plan of what makes the most sense for that family, for where they live. Accessibility is important. And then getting them connected and helping them navigate that provider community along with maybe some of the systems that they may be interacting with. So that navigation. I love this slide. We took it from the medical community, but it's very much applicable to the assessment center community as well. And when we talk about case management, we're talking about a hot and warm, because we really don't want to be doing a screening and assessment process and then giving youth and families a list of providers to call and telling them good luck. Right. So that cold is like off the table. What we want to see is, assessment centers really facilitating a warm handoff to the providers, maybe going with them to certain agencies and organizations that they're going to be connecting with, and following up, checking in, really making sure that they're supported, that they're connected, and then obviously at some point kind of backing away. A couple questions that we get a lot. So just putting the next few slides up, because I know a lot are, well, how do they operate? What does it look like in practice in terms of assessment center operations? One really important piece is that, and I mentioned this at the beginning, assessment centers are not service providers and should not be service providers because there becomes either a real or a perceived conflict of interest when in terms of where referrals are going when that becomes the case, right? So we want assessment centers to be doing screening, assessment, and connection to care without pressure to refer inwards into their own services and supports. So that neutrality is really important. We also talk about neutrality in terms of, away from system stakeholders as well. I think that's, just as important, but where we get the most questions is around who operates a center and how does it interface with the service providers within the community. They're not intended to compete with the service provider community. They're intended to leverage and support the service provider community. In terms of accessibility, these are another couple questions that we get. There are assessment centers that are appointment-based. There are assessment centers that are 24/7 and allow for law enforcement to drop off young people, especially those assessment centers that are serving kids, maybe all kids that have been arrested, or as an alternative to detention. That is definitely the case. The center that I used to run, we had respite beds on site when, we didn't want detention to be an option, but maybe home wasn't an option either. And so, we were able to have law enforcement drop that young person off, and we facilitated access to the respite beds. We didn't run the respite beds, but we facilitated access to them on site. So all of those are ways that assessment centers run. The Douglas County, the assessment center in Nebraska, they do not allow for law enforcement to drop off. They are appointment based only. So these are all the ways that assessment centers can operate in real time. The other piece, and a lot of questions that we get is, are they, kind of where are they located in the community? Obviously, if you're going to have a law enforcement drop off, there is a kind of a bricks and mortar facility that law enforcement come to, but they can also be mobile. The harbor in Las Vegas has done a really great job of creating mobile units that go out into the community. They can also be co-located within schools, within recreation centers, within libraries, especially for schools that are maybe high needs. And have a lot of support around chronic absenteeism or suspension, expulsion. It might make sense for assessment centers to co-locate or have space within those schools. So all of those are options. All of these models exist across the country. This is where, again, kind of it depends on the local community in terms of how the assessment center is going to function. The last slide on operations here, again, another common question is who runs assessment centers? And this is, some like this answer, some find it frustrating, but it depends on the community, right? So I would say about 5 to 10% of the assessment centers that exist around the country are their own 501c3, their own nonprofit. They don't have any other they are not providing services, right? They are an assessment center. Their 501c3 is really just centered around that function. They might provide, the one thing I will say in terms of services at an assessment center, they might have, some like a food bank on site. They might have clothes, meeting basic needs for youth and families on site. But when we're talking about a service provider, we're really talking about like ongoing therapeutic services that is really where that connection happens instead of the providing services directly to youth and families. The remaining assessment centers around the country are really operated under some level of government, either city, county, judicial district. We have one that does a collaborative staffing model. So it's a whole lot of kind of different departments that come together to staff that assessment center. The Shelby County one is underneath their county community services. You see other assessment centers that are stood up kind of underneath their judicial or their court, keeping systems and data management separate, but still underneath some kind of governmental or county court function. So when we're looking at outcomes and the National Assessment Association, we have what's called the Assessment Center Outcome Reporting Network, or ACORN, where we really are giving communities tools to track data that align with the assessment center framework. What we're really looking for is a couple different things. One is that we're getting feedback from youth and families during this process. At every step along the way, right at screening assessment, during that connection to community services decision point, and then 12 months down the line to really ask them, one, immediately during the screening assessment process, did you feel heard? Did you felt like you had input? Did you feel like you were listened to? Then were you connected to those community providers? Did you feel like that was the right connection? But ultimately, do you then feel like you have a positive connection to your community from both the child and the caregiver? And did we see some of the reasons why that initial referral was made decrease, right? So we're really getting youth and family feedback, but we're also looking at our young people and families kind of escalating into the justice system or the child welfare system after that initial referral is made. The last two bullets here really speak to that hub function. So do communities have more streamlined access to community supports? So instead of, I refer youth and families to the providers that I just know of, do we have a hub in a way that kind of streamlines that process and make sure that we're looking at needs and strengths before we're making those connections? And the last thing I'll say before I hand it over to Carly, a lot of questions come about, in terms of, well, where are assessment centers? What are the assessment centers that you would point us to? The National Assessment Center Association has what's called the Center of Excellence. And this is really a pathway for assessment centers that are existing to align themselves with the framework. We do self-assessment cohorts to look at where do existing assessment centers have alignment, and maybe where there are opportunities to increase that alignment, and kind of move towards full implementation of the core components within the framework. So you can see it's on our website, a list of assessment centers that have engaged with us in some level of the centers of excellence. And coming soon, I would say just in the next couple of weeks, we'll have profiles on each one of those centers. So if you're looking for centers to kind of to read about and to learn more about how they're serving youth and families in their communities, that would be the place that I would recommend going. We also have on the website the full assessment center framework, where it's about 65, 70 pages, where you can read in much more detail about the assessment center framework, about best practices, about the two structural core components that I didn't really talk too much about today just because of time limitations. But there are resources on the website that you can access to get more information about the framework specifically. So I'm going to turn it over to Carly so that she can talk a little bit more about the NAC and more specifically about what type of support the NAC provides to communities.
Thank you, Molly. So I'm going to take a moment to more formally introduce the NAC, the National Assessment Center Association. As Molly mentioned, this was founded in 2019, and it was really founded in recognition of the fact that there was this void in the field. Assessment centers have had at that point existed for, well over 20 years, 25 years, and there was not any kind of national infrastructure that would pull standards and provide training and technical assistance, or really kind of create a unified voice for the field of assessment centers. And so the NAC was founded to fill that gap and really serves as a hub for coordination across assessment centers, research, training, technical assistance, and advocacy. So really supporting local communities to develop, strengthen, and sustain their assessment centers. The kind of broader lens of what the NAC does is to really support assessment centers, create a national network of assessment centers that operate with consistency, with kind of quality, and ensure that every youth, no matter where they live, can really access this coordinated response through this hub. So the way we do that is through a number of different very particular buckets. The first is to really focus on creating standards. And this is the assessment center framework that Molly mentioned that's available on the website. But the standards are really establishing and promoting best practices for what an assessment center is. So the framework, which really guides what is considered a center of excellence through this Pathways to Excellence program, provides a common foundation for what the operation of an assessment center is. So what does the process look like, and what does the structure of an assessment center look like? There are resources that we provide around standards to really help communities translate some of these concepts, like what is a single point of contact, into operations in a way that's really reflective of the community needs of the stakeholders that are present and engaged in the planning process, but also still in alignment with the framework and the standards of what an assessment center should be. We also provide a lot of peer-to-peer networking, and this is really critical for assessment centers that, prior to the NAC being founded, really operated in isolation or through individual connections that were formed. So peer-to-peer networking is one of the priorities of the NAC. We do this in a number of different ways. One of them is to convene an annual symposium where assessment centers from, again, communities and assessment centers from all across the country come together for a couple of days to learn from one another. This is there's a huge focus on the presentations, the information that's being shared coming directly from assessment centers, and being able to speak to other assessment centers about something exciting and incredible that they're working on, or really just how they've learned to operationalize or address certain issues within their assessment center. We also facilitate regular structured opportunities for peer-to-peer, whether this is, for example, our monthly director circle, which is a community of directors of assessment centers from, again, all across the country who convene once a month to really talk about and learn from one another in terms of what are some of the challenges that they're encountering and how are they addressing those. We also have a peer network for communities that are launching assessment centers, and that's not only a peer community for those individuals who are in the planning and early implementation process to learn from one another, but those kind of networks are actually facilitated by assessment center staff from assessment centers that have been in operation for 20+ years. There are also other structured learning networks, whether we're thinking about rolling out CQI processes or thinking about other ways to support kind of youth and family engagement, where there's really kind of like a learning community that really facilitates and uplifts that peer-to-peer networking piece. We also do a lot of technical assistance. This is working directly with a community, and I will talk a little bit more about this in a second, but working directly with individual communities, whether they are in the exploration phase, the kind of planning phase, or the early implementation phase, or assessment centers that are operationalizing or sustaining. So we really think about the full continuum of communities that are engaged in assessment centers, and provide a range of kind of operational support, planning support, data support in order to support assessment centers. There's also a lot of training and information sharing. I think one of the favorite things that communities really appreciate and resources that they access a lot is a resource library. which is available to members of the NAC, communities that are in the kind of, whether it's planning early implementation or really kind of operationalizing, where there's resources that have been provided by other assessment centers or kind of developed by the NAC to support operationalization of the framework in different communities. Also regular training. So there's a lot of support that we provide around training staff, training other stakeholders that engage with the assessment center on what the assessment center model is, what each of the process and other kind of structural components are, and provide support to really ensure that communities and assessment centers are able to really implement their assessment center in alignment with the framework, with best practice. And finally, we also do a lot of work with federal, state, and other stakeholders to really support assessment centers at the local level. So whether this is through, thinking about how states can support through funding, through policy, the development of assessment centers, or through integrating this work of assessment centers into broader systems reform efforts. This is something that we work very much with our partners around as well. So as I mentioned, sorry, I'm going to talk a little bit about the individualized technical assistance approach. You'll see here that we've broken it out really into 4 different categories. So we think about where a community is in their development of an assessment center, and then have structured ways of really providing support that's unique to that phase of development or operationalization. So for communities that are in the exploration phase, so really seeking to understand what is the assessment center model, how may this fit in with the kind of problem that we're trying to solve in our community. We offer those communities an assessment center 101 training, which is a little bit more in depth than what you're learning today, where we really introduce the model in more depth, talk through each of the guiding principles and each of the components of the framework, and then really kind of can provide some strategic planning or action planning around how does this fit, or does it maybe not fit in with the goals of our community. Once a community has identified that the assessment center model is something that does indeed fit the kind of local need, there's, of course, a planning phase. And for that planning phase, we really help communities move from what their vision is to operationalization of the assessment center model through a process that is really data-driven. So intervention mapping, where we really guide the community through a process to understand how youth are currently moving through local systems. There's a significant data component to this as well. And then really asking the question, where does an assessment center fit in, and where could it provide that early intervention, that prevention, that diversion, or that early intervention to prevent deeper systems involvement. And then from there, we really provide support around operationalizing the framework. So taking all of those standards and helping the community develop local operational plans, whether this is from, defining referral criteria, implementing policies to support referral so that the assessment center is indeed serving as a single point of contact, designing screening and assessment systems and processes that really kind of fit with the vision of the community, and building that infrastructure, and really identifying what are the local community assets and how do we make those connections in a way that best supports youth and families and leverages what is available in the community. For assessment centers that are in operation, there are a number of different ways that we support them, whether it's specific technical assistance or training to strengthen a particular component of the assessment center framework. It's enhancing their screening and assessment system development. Or it could be something, in terms of for a system, how are we, beginning to collect data? So what do those kind of data systems look like as well? And then finally, for communities that are have moved beyond that kind of initial planning and operationalization, and they're really focused on sustainability. This is where, you know, a lot of our work around CQI data collection. We have a new outcome measurement reporting network, the ACORN Assessment Center Outcomes and Referral Network, which is really serving as a common data framework and data management system for assessment centers to be able to track outcomes, to be able to report those not only to their own stakeholders in their own community, but to create a national database of how assessment centers are functioning and what their outcomes are, leveraging shared measures and data across all of the assessment centers that are participating. Again, speaking to that piece around advocacy as well. And with that, I think we both have time for some questions, or maybe we'll just be moving into breakouts. And
I think we've got a couple minutes that we can just pause for some questions before we do breakouts. Feel free to use the chat function, or it feels like we're, Jenny, tell me if I'm wrong, but it feels like we're in a meeting format as well. So I would say, you know, if you want to come off.
We are in meeting format, so people can come off of
Okay.
video or come
stop.
on video and speak if they so wish.
Thanks, Cody. There's one question from Mia. Is there a cost to getting help with setting up a center? Mia, so there's a couple different levels of support in terms of that the NAC offers. There is a membership level that is free. So there's, if communities want to engage with the NAC, that you can get access to certain resources and support. That some of most of the technical assistance that was on the last slide that Carly had up is at some cost, right, to communities. And that might be something that they get a grant to help do. That might be a county contract. It really looks different. But membership, initial engagement with the NAC, there is a free level, there's a paid level of membership, and then there's technical assistance that also has contract costs that go with it. Yeah, Mark, go ahead.
A stupid question, maybe. In the early stages of organizing a center, is there a way to characterize either passive or active opposition to the concept and to the development of it? Who's against it?
That's an interesting question. I would say that varies community to community in terms of what sort of opposition, if there is any, and where that stems from. I don't know that there's, you know, kind of like a common thread line through communities in terms of who.
Sure.
Because there's really, if you think about benefits, I think it all depends partly on how it's framed, right? But there's definitely a value add when you're talking about law enforcement, district attorney's office, the courts. I think, it's taking the time to sit with each one of those stakeholders, either in some sort of kind of community educational format or one-on-one, to better understand the framework. Because I think, at least in my experience, the opposition comes from a place of not like just a lack of knowledge, right?
Sure.
And so outside of that, I think it really is community to community. Carly, I don't know if you would add to that, but.
The only thing I would add to that is kind of pulling back to that slide that you highlighted, Molly, which is the neutrality component. This is why neutrality is so important for an assessment center. Initially, if an assessment center is operating, they are providing a lot of services. I think some of that kind of challenge that they might encounter would also be with the service provider community. But that immediately gets taken out when the assessment center is really serving in this very neutral role. I think service providers and community assets more broadly very much view this resource as a benefit to them as well.
Other questions, comments?
Molly, it's Andrea. And I
Andrea.
just wanted to say, I have just loved watching your journey through the years and where you are now. It makes total sense. I met Molly when she was in Iowa with Scott County Kids. Is that right?
Long time ago, Andrea.
A long time ago,
Yeah.
doing Handle with Care. And then she went to
That's right.
Colorado. And now I love the program. I love the program. It's just so needed.
Thanks, Andrea.
And it meets the kids where they are.
That's right.
All right, Cody, do you want to send us to breakouts and we can be in a little
Yeah.
bit smaller groups and maybe process through
Absolutely.
a little bit of this?
All right, I'm opening the rooms now.
Is there any like key takeaways that you have? We had a great discussion talking through, you know, how assessment centers were different and how who might not be on board and how, you know, so I thought that was great. But I don't know if you guys had some takeaways or things that you know, definitely if you want follow up, you know, how to get a hold of Molly and Carly, and we will send out a recording and the slides. But is there anything else that really struck you today that you wanted to share back with everybody?
In our breakout room, as you were talking, Carly, I immediately thought of McKinney-Vento, the homeless kids, and all the things that could be affecting their behavior and their survival. And I could really see how this wraparound could really help them navigate the systems because they're not going to know how to navigate the systems and they're not going to have a whole lot of support probably to try to figure that out. Am I getting it right, Carly?
That could certainly be a referral pathway.
Yeah.
Molly, I don't know if you're aware of any communities that really are thinking about that pathway or working in the kind of homeless youth.
Yeah, and I think the pathway there, Andrea, to your point, for a lot of jurisdictions is the schools. Especially when they've identified that, you know, a young person is unhoused or from, you know, jumping from house to house.
Mm-hmm.
Absolutely.
I was just thinking too, when we were talking, it's very different if you're court ordered to do an assessment and a mental health assessment and how that information is shared and the having worked with clients like that before, the feelings of being coerced into accepting services versus getting a screening, having a really warm handoff and someone saying, yeah, I think I do need this, you know, and how that information flow happens in a much less coercive, more trauma-informed way with families. So that's what I was thinking when I was thinking about this versus you will go do a mental health assessment and then the entire court team will read all the nitty-gritty details of your life. And it's pretty invasive. So I certainly wouldn't want to do that. So you can just unmute Mark if you want to.
You're still muted, Mark.
There we go.
Forgive me, I'm sorry for being clumsy. Sometime into the future, I would like to learn examples of children helping each other, of communities discovering hidden solutions, and learning from each other rather than from us. And so if there are examples of that, please so inform as we start to work together.
Great. Yeah. I think Leslie, City of Orlando has done a lot with their youth, and there's some of that going on with their youth helping other youth too. So that might be
Disclosure, I come from a positive deviance background, and I'm interested in how people help each other.
Yeah, so we currently have 3 youth leaders that have been impacted by the justice system, and they're actually young adults that were impacted by the justice system, and they're going to be leading groups every month, and they're totally going to be facilitating it. I've been working with them on a weekly basis, and we've been talking about different topics as far as the youth justice system and as far as scenarios that they've been through that affect their neighborhoods, and we've been talking, like I said, on a weekly basis. They're actually we're actually paying them on a weekly basis, but the kids that are going to be participating in the groups, they're going to be incentivized as far as getting a $75 gift card for each group that they participate in.
Good. Thank you.
That's great. Yeah. And Mark, I don't know who your coach is through JBS, but definitely let them know that's something you're interested in, and we can set up, peer calls too. So
Thank you.
Well, thank you, Molly and Carly. This was great. We really appreciate the work you're doing, and we know this is an important part of the continuum. Really, this assessment center piece and the early intervention piece. So we're happy to have you. If there's nothing else, then you guys can have a whole 9 minutes for your next Zoom call. So use it wisely. So, all right.
Thank you, everybody.
Thank you.
Thank you, everyone. Bye.